Apraxia of speech is a neurologic speech disorder that reflects an impaired capacity to plan or program sensory motor commands necessary for directing movements that result in phonetically and prosodically normal speech. It can occur in the absence of physiologic disturbances associated with the dysarthrias and in the absence of disturbance in any component of language. Unlike the dysarthrias, it can exist without clinically apparent impairments in the speech muscles for non-speech tasks. Unlike aphasia, in which there is nearly always multimodality impairment of language, loss can exist independent of problems with verbal comprehension, reading comprehension, and writing, as well as independent of spoken errors unrelated to articulation and prosody. Limb, nonverbal oral, other speech language deficits, and patient complaints that may be associated with loss. Limb apraxia, on the other hand, is a different neurological condition that affects a person's ability to plan and execute purposeful movements with their limbs, typically the arms and hands. These two conditions are related in the sense that they both involve problems with motor planning, but they affect different areas of the body. Limb apraxia can manifest in various ways depending on the severity and location of the brain damage or dysfunction. There are different types of limb apraxia, including ideomotor apraxia and ideational apraxia. Ideomotor apraxia. This type of limb apraxia involves difficulty in performing specific motor actions or gestures on command, even though the individual can perform the same actions spontaneously. For example, a person with ideomotor apraxia might have trouble imitating simple gestures like waving goodbye or pretending to brush their teeth. Ideational apraxia. Ideational apraxia is more complex and involves difficulty in organizing and sequencing a series of movements to complete a purposeful task. For instance, a person with ideational apraxia may struggle to perform multi-step activities, like making a cup of tea, because they have trouble planning and executing the necessary movements in the correct order. It's important to note that apraxia of speech and limb apraxia can co-occur in some neurological conditions, but they are distinct from each other and affect different aspects of motor planning and execution. The specific treatment and management of these conditions may vary, often involving speech therapy or occupational therapy, respectively, to help individuals improve their motor skills and functional abilities. The underlying causes of both apraxia of speech and limb apraxia can also vary, including brain injury, stroke, neurodegenerative diseases, or other neurological disorders. Oral apraxia of speech, also known as bucofacial or orofacial apraxia, is a specific subtype of apraxia of speech loss that affects the ability to coordinate and execute the precise movements of the muscles involved in speech production within the oral cavity and face. It is a motor speech disorder that primarily impacts the articulatory and facial muscles used for speech. Individuals with oral apraxia of speech may experience difficulty in planning and executing the movements required for speech sounds, resulting in speech that is characterized by inconsistent errors. The errors in speech production may vary from one attempt to another, even when attempting to produce the same word or sound. Groping and trial and error behaviors. People with oral apraxia of speech may exhibit repetitive or groping movements of the tongue, lips, or jaw as they attempt to produce specific sounds or words. Slow and effortful speech. Speech production may be slow and labored due to the difficulty in planning and executing the precise muscle movements. Impaired imitation. Individuals may have difficulty imitating speech sounds or oral movements demonstrated by others.